The last few months, one of the things which really raked up the world was a talk and discussion about ChatGPT. And I thought in today's world where we are talking about, how we would reduce technologies, the best way to start would be asking ChatGPTs about doctor-patient communication. And I will, share a small conversation, 3 minutes, that we have with ChatGPT. I think you'll understand. This is an audio. Hello, ChatGPT. Good morning. I would love to know who you are and how you describe yourself.
I am ChatGPT, an artificial intelligence language model developed by OpenAI. My purpose is to provide helpful and informative responses to questions and tasks posed by users.
That's really useful for us to know. Do patients with cancer who are not responding to treatment prefer to know about their health?
The preference of patients with cancer who have not responded to treatment about receiving information on their health can vary widely and is influenced by many factors, such as their cultural background, personal beliefs, and psychological state. Some patients may prefer to have complete and honest information about their condition, even if the news is not good. Other patients may prefer to receive less detailed information or to have the information delivered in a more gradual or indirect way, in order to avoid feeling overwhelmed or distressed.
Now that you are around ChatGPT, do doctors need good communication skills?
Yes, doctors absolutely need to be good at communication skills. Effective communication is essential for building rapport with patients, understanding their concerns, conveying information about medical conditions and treatment options, and helping patients make informed decisions about their health. Doctors who lack strong communication skills may struggle to establish trust with their patients, leading to poor patient satisfaction and outcomes. They may also struggle to communicate complex medical information in a way that is easily understood by patients, leading to confusion and misunderstandings.
ChatGPT, one last question for you. Can you please write a rhyme in English on communication skills?
Sure, here's a quick rhyme on communication skills. When you talk, it's not just what you say, but how you say it, in every way. Listen well and let others speak. And watch the tone that you do leak. Good communication is a vital art. To connect with people, heart to heart, choose words that are clear and true, and empathy will flow from you.
ChatGPT, thanks so much for all the wisdom that you have shared with us. As a communications skills trainer, I am grateful that you could go through the vast database and come up with these answers for our audience. So that's it. So I think, I was convinced that it's important that we still emphasize on the low priority often in Southeast Asia, including the country I come from, on doctor-patient communication. And why this is important is because, it improves the trust of patients in doctors. It also explains, the risks which, more and more patients are on Google. They translate things. So we live in a globalized world, and we need to communicate prognosis. There are special groups of children or elderly with dementia who might need to be told about their cancer treatment differently than others. Oncology can be a very satisfying profession, but at the same time has its own challenges. And communicating with colleagues, all senior oncologists here would agree, that is very crucial. And in handovers, when patients go from one treatment facility to another, or from one tomb to another, I think it's important that they don't slip through the nets. Let's talk about Chaya. Chaya was 62 and was a scientist who had retired and was in New York with his son, driving in the car, and suddenly there was an accident. And in the accident, Chaya's wife died immediately. Chaya had a thoracic injury, was stabilized in the hospital nearby. And while stabilizing his thorax, the CT scan diagnosed there was 2 small spots in the lung. So this was a patient who had to actually get better. Hopefully, Chaya actually luckily got better. He came back to Cambodia. And then he was dealing with three things. One is that he had lost his wife. He had been, going through the treatment of cancer, got to know that he has cancer after he had a histopathology diagnosis of the spots that he had in lung. And he was going through the post-traumatic stress disorder of living through the car crash. So always remember that cancer happens to real people. It's not that we just diagnose and treat the tumor. So when Chaya meets the oncologist, the things which he has in his mind is, will I live? Will my son be able to cope now that he has lost his mother and I might die as well? While the oncologist is thinking about that what would be the pathology of the treatment of the lesion that we have got? Will he tolerate my treatment? What is the ECOG rating? And the friend who accompanies Chaya to the OPD clinic is thinking how costly would be the treatment. So you can imagine that in a room where there are three stakeholders there, communication is crucial because each of them have different answers to find at the end of the discussion. Almost always, all patients want to know about their diagnosis and treatment. However, patients prefer to discuss this in presence of their family members. And to be absolutely clear, I have practiced medicine in the United Kingdom and in India, in various parts of India, in various cultural settings. If you have cancer, you actually go to the oncologist almost always with a family or a friend, even in the West. So cancer clinicians need to be skilled at not only communicating with patients, but also communicating with family members. And clinicians want to communicate, what the treatment is needed, communicate around consent, because without consent, today's world, you can't give treatment. And unfortunately, sometimes we also try to avoid difficult communications. Now, communicating appropriately, there are four broad areas which has an impact. Say if a patient is on chemotherapy and, in a country like India, you have to tell the patient that they need to avoid street food because that might prone the patient to infections. Somebody without cancer and not on chemotherapy might have a diarrhea for a day or two, but with cancer, you might end up getting into a hospital, sepsis, antibiotics, which are expensive. So, this is a real person. So the patient needs to know that this is the lifestyle he needs to lead for the next few months. It also prepares patients for all the symptoms that they might have. And, fears which are unknown are often more fearful than fears which are known. And communication is crucial there. It also improves the rapport and the trust with the patients for doctors, reduce misunderstanding. The medico-legal aspects of care, there are less complaints, even if there are no lawsuits, I think managers often have to deal with complaints, and communication is a crucial part there. There is also less misunderstanding between colleagues and better integration within the organization. Now, families, may have certain peculiar or certain specific aspects of communication that you need to be mindful. Our research has shown that, first of all, we need to be ensuring who the person sitting with the patient is. So is this a son, daughter, father, mother? That constitutes usually the 70% of the families. So who constitutes family? The clinician needs to first establish who is in the room and ask the patient, do they feel like involving the family in the treatment decisions? There might be times when one member of the family has a different view from a different member of the family, and that's not unusual in any families. You don't have to have a cancer diagnosis. You have to remember that you have to go by more or less a consensus there, because it's very difficult for a place like Philippines, which I was hearing just now, where a lot of cancer treatment is from out-of-pocket expenses. You may have to actually explain the necessity of a particular treatment to the patient and the family together. Now, sometimes as a medical doctor, you might be faced with the dilemma of what is the best interest of the patient versus what the patient wants. And in today's world, 2023, I think you have to go by the best interest, by the patient's preferences. There is no two ways about it, particularly if the patient is an adult. There might be family history, say hereditary breast and ovarian cancer, grief in family members. They have made, they have seen patients in their earlier generations who have succumbed to the disease. And this anticipatory grief colors the way they engage to oncology. So these are the communication challenges and how we deal with families. And if you are perceptive of that, you will deal with this situation better. The research which, by the way, I have sent a handout for all the publications, and most of them are open access, so they will be emailed to all the participants, so you don't have to take any notes. So a son of a patient said, patient talked about his son saying that, I think my son will help me recover and do whatever is necessary. And even oncologists often felt involving the families are good, so head and neck oncologist would say that if you train the family members about feeding a patient post-operative through the feeding tube, the duration of hospitalization may be reduced. So I think what we found that if from day one you communicate with the patient and the family, I think you have a win-win situation. There will be conflicts within the family. The way to circumvent that is communicating effectively. Understand that consent can be only given by the patient because it is his body who is having the treatment. Sometimes family members may be in a situation, I'm sure this is not uncommon in Cambodia as well, don't tell my dad or don't tell my mom about cancer. You need to understand that they love their near and dear ones, and instead of explaining, understanding why they are protective about it and trying then to explain that why the patient knowing about the diagnosis and the treatment would help, working with the family members would be a win-win situation for all of you. Now, what are the barriers and perception of clinicians in during communications? We often talk about time. Are we always short of time? Now, many of you would be doing telephone banking or having telephone services. What is the last question that people ask? Often, do you have any other questions? And do you know, this was tried in the United Kingdom for general practitioners, and most patients, on an average, ran out of steam in 90 seconds. And if you do the same in your clinic, I think most people will not have questions, but their satisfaction will increase. Having worked in various cultures with different languages, I think, the cultural differences are far overplayed. We are much more similar than different across the world. And when we have to address patients and staff agenda, you might have to explain a particular modality of treatment. Go by the patient's agenda first, because then you'll find it easier to communicate what you have to communicate to them. Sometimes it requires some confidence in communication. With time, you build that confidence. When I had started, I was not a confident communicator. But with time, when I realized that I could communicate with a vast, wider range of people. So you might be unease with strong emotions, say a patient crying or a family member being upset. So these could be barriers, and seeing a patient as a person as opposed to a body often helps in circumventing these barriers. When you start seeing a patient, I work in a hospital which has electronic medical records, which is by and large the way forward for most of the places now. I think the first thing I see is, why is the patient being referred? What is the age, gender, address of the patient, and the cancer diagnosis of the patient. So I think if there is, from the notes, I anticipate that there might be difficulties, that makes me help prepare. So the key to communication is prepare, 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 even if you have 3 minutes before you see the patient. Everybody, when you communicate, if you go and talk to them, that you know something about them, they would, listen to you more than if you ask the question, how are you today? So sitting arrangement, it starts from there. If there is a table between you and the patient and the relative, that often acts as a barrier. We are reminded of, our school headmaster, headmistress. This is a much more welcoming setup. And, not having a barrier between you and the patient encourages open communication. Let's talk a little bit, I'm a child psychiatrist, let's talk a little bit about communicating with children. Children, say Dara was a child with leukemia who is 7-year-old, and he was worried about what will happen to me tomorrow. He was planned to have a bone marrow biopsy, and the question he had was, will it hurt? And the pediatrician could actually explain to him the procedure at a level that he would understand. One way of telling children that it may not hurt in this situation could be that, putting a little bit of anesthetic cream on the child's wrist and showing how it becomes numb, and that tomorrow when we do the procedure, it will be similarly numb, he won't feel much pain. So when you interview children, you need to have an ambience where it's comfortable for the child. Children often may not want to initiate conversation with you. So if you have some, drawing or some task, they might be more easy to communicate. And they're often not very good with, sort of why questions. Actually, none of us are very good at why questions. So do not start the interview with the most sensitive topic. So work on understanding. There might be a father and a mother who disagree and you are seeing the child. Work on understanding what's happening in the room. And sometimes clinicians also try to be over-friendly, behaving like a child. So children and adolescents very well know that you are an adult and you are an oncologist. You have the power to do tests on him. So I think you should be friendly, but not necessarily have sort of childlike behavior. They may appear very sham. So one of my students did a PhD on information sharing in pediatric oncology, and that's, again, I have shared the link. It's in ecancer journal, and we covered various aspects, how children relate, how adolescents relate to children with cancer clinicians, and what are the information needs of parents. And it's also a journey for the clinicians to go through this. We had proposed a model, like, not having the same person just because he or she is good about it to do the communication, because, you need to take turns in terms of who leads the communication, prepare what needs to be communicated, have a script for the child in case the child is there during the communication event, having a way to prime the family. So in the morning, if you tell that we have something to discuss with you in the afternoon, so most children and particularly families know that there might be some difficult news coming. See, good news, nobody primes, but for bad news, often such a priming helps. And always have some time for questions for the families to ask you, and end with a plan. It might be a terminal event. It might be, you have very bad news to say that a disease has come back and it's not responding to treatment. But even then, you could have some hope for the family that you could reduce some of the symptoms through which the child is going through. Believe me, it isn't easy dealing with pediatric palliative care, but just because it's easy, it doesn't mean that you should not do it. And after the session, reflect within the team, how did it go? And communication learning is a lifelong process, and it's important that you keep learning. I am still learning. The key principles to engage patients are, to understand that it may wax and wane, and engagement into the process. You need to have constant attention about how it is going. Speak to the young person or the adult directly when you can, and treat the patient as responsible and capable of making some of the decisions at least. So an adolescent might not be able to decide what kind of treatment he prefers, but he may want to decide that I don't want my next cycle of chemotherapy on the day of my birthday. So one day you might want to shift the day. Try to be yourself. I think that's very important in authentic communication and having an empathic and non-judgmental attitude. Communication may not be easy always for clinicians. Some patients may provide very little factual details, but as a clinician, you have to have a comprehensive history and make sense of what is being conveyed. Some patients might offer a vague clinical history, but you ensure that you clarify the salient details not in an interrogative way, but in a friendly but comprehensive way. Some patients are emotional, and you have to reassure and be empathic about them. Some patients might actually make frequent requests for help. You as a team in cancer setup need to offer consistent medical support. They may shift alliance from one team member to another, but you offer a team approach when you see the patient. Some patients even might provoke emotional reaction in you. You need to reflect on your emotions during clinical encounters so that you remain calm. How do you learn communication skills? So I think it's best that you start for residency programs at the beginning in the induction training. Arrange communication skills workshops with role plays. Many clinicians have learned communication by modeling upon senior clinicians who are good communicators. So that's one way to learn. And goldfish bowl technique is, it's like getting some ex-patients sitting in a round circle, talking about what they felt while they were communicating. And the patients and the clinicians are, in the outer circle. So it's like we are watching a goldfish in a bowl. So you get to have perspectives which you have not heard before at all. So patient and public's perception of care and treatment is a strand of research which has developed in the last 10, 15 years. And I think it's important that we remember at the end of the day, we are here because for the patient. So I would like to conclude that communicating is important in oncology as in all parts of medicine. And with patients, we need to be truthful and we communicate with empathy. You need, as a clinician, to keep learning. It's important that you have a life. Less stressed oncologists are often better communicators. Thank you.